If you're considering LASIK for specs removal, one key question you might be wondering is flap LASIK or flapless LASIK. Almost every patient wants to know about the difference between flap LASIK and flapless LASIK. Today, we'll talk in detail about the benefits and issues of both these procedures. Flap LASIK is a surgical procedure that includes C-LASIK, contour vision, and femto-LASIK. In this, a flap is created in cornea's superficial layer. This flap is made using a microkeratome or femtosecond laser. Once the flap is made, the laser is used to reshape the cornea, which improves vision and removes the specs power. Flapless LASIK includes epicontura, trans-PRK, smart saw. It does not require creating a flap in the cornea. Instead, it uses a direct laser on the cornea surface to treat and correct the specs power. Now let's compare both. First, recovery time. In flap LASIK, since the flap is created in the surgery, recovery is quite fast. Typically, patients experience clear vision within 24 hours. In flapless LASIK, since no flap is created, recovery is slightly slower. Although patients see an improvement the next day, it may take 1 week to 10 days for complete vision clarity. Second, safety. In flap LASIK, some rare complications related to flap can occur, such as flap displacement or other flap issues. However, these issues are very uncommon. In flapless LASIK, since there is no flap created, it is considered a safer option with no flap-related complication, making it a highly secure choice. Third, pain and discomfort. In flap LASIK, the surgery is quite comfortable, but some people may feel slight pain or pressure when the flap is created. After the surgery, mild irritation can occur, but patients generally feel comfortable by the next day. In flapless LASIK, no flap is created during the surgery, making it completely painless. You may not even realize when the surgery starts and finishes. However, for the first 24 hours after the surgery, you may experience a bit more burning, irritation, and watering than the flap LASIK. Fourth, weak corneas. When the cornea is slightly thinner or has a flat or steep shape, flapless LASIK is preferred because creating a flap can be challenging and flap might weaken your cornea further. Fifth, retinal problem or other eye disease. If the patient has other eye issues such as retinal problem or glaucoma, flapless LASIK is often preferred because it doesn't exert any pressure on the eye during the laser procedure, whereas in flap LASIK, a lot of pressure is put on the eye during the procedure. Lastly, flapless LASIK is often chosen for athletes, defense personnel, or those in physically demanding jobs due to the lack of flap, which minimizes the risk of flap damage from any eye injury. If you're looking for a fast and effective solution for specs removal, flap LASIK is often the first choice due to quick recovery and effectiveness. However, for those needing a no flap solution due to corneal structure, lifestyle need, or safety, flapless LASIK offers a great alternative. If you're ready to explore LASIK option and say goodbye to specs, call our helpline number today to book a free consultation. And if you have any other eye-related question, feel free to ask in comments.